I'm really happy to see everyone joining us on this beautiful evening tonight. I'm Laura Ellsworth, the Strategic Partnerships and Advocacy Manager with Council for the Homeless, and my pronouns are she, her, hers. Thanks again for being here. I do see a lot of new folks coming in tonight, so I just have a few reminders for us as we get started. First, the only people that you are going to see in here tonight are the panelists and hosts, so please post any questions that you might have in the chat or the Q&A feature. The webinar will be recorded and shared out afterwards on our website. You'll receive a link for that. Please also, if you can, take the survey that's going to appear in your browser at the end of our webinar. It's just 3 questions, and we really appreciate you providing the feedback for us. It helps keep us accountable for what we do cover in these webinars and also helps inform future topics. So we have a great panel for you tonight that is going to help put the data that we will be reviewing into context. I'm going to start us off with just some level setting about what exactly the homeless crisis response system is, what the key components of a homeless crisis response system are, and some broad observations about what the system data tells us about homelessness in Clark County in 2022. And there are some hard truths to confront in this data. And as we dive into the numbers tonight, I do want to just recognize that each data point in the reports that you will be looking at represent a person, a family, a child, a teen, or a senior living with the instability of life without a safe and stable home. And some of the information that you'll be seeing tonight, it won't be surprising, and it will probably make you feel sad and even angry. Anger at the fact that homelessness has really become a community burden that we all shoulder. And if there's one thing that I hope we've all learned these past several years, it's that homelessness does not exist in a vacuum of bad individual choices and circumstance. The pressures that are squeezing people and communities causing homelessness are only increasing as rents have gone up. Housing stock remains in critical short supply, and impacts of a global pandemic continue to be felt. So the data and the numbers that you will be seeing tonight are from our homeless crisis or from our homeless management information system, or HMIS database. HMIS is a local information technology system that's used to collect participant data and data on the provision of housing and services to homeless individuals and families and people at risk of homelessness. In Clark County, we have 39 local provider agencies with 337 individual users who input their homeless services data into the HMIS database. And that's what the numbers that you'll be hearing tonight are based upon. I'd also like to introduce you to my colleague, Dale Whitley, who is our HMIS administrator. Dale's going to be helping to monitor the chat and answer any questions that might come up tonight. And again, I do apologize that that doesn't seem to be working properly, but thank you, Dale. And hopefully the links that you'll be able to post later will be available to everybody. And before we really dive into the numbers, I just want to explain also what the homeless crisis response system is by using an analogy. I want to start out by emphasizing the words crisis response when we think about the homeless crisis response system. So think of homelessness as a sink that is filling with water. The water represents people already experiencing homelessness, and the faucet flow represents the number and rate of people newly or repeatedly falling into homelessness. And the drain is how many people are exiting homelessness. So the homeless crisis response system's role is to address the water in the sink and to try to slow the flow of water coming in, all the while simultaneously keeping the drain as clear as possible so that people can resolve their homelessness as quickly as possible. Unfortunately, the system cannot control things that contribute to a faster stream of people falling into homelessness, like skyrocketing rent, minuscule vacancy rates, higher than ever costs for housing, not enough housing units, global pandemics, and under and unemployment, among many other things. And among people who are experiencing homelessness, there's a continuum of need and a continuum of service interventions. And along that continuum are folks on one end, maybe, with temporary needs going all the way up to those who need permanent assistance for the most critical of needs and vulnerabilities. And all along that continuum, the homeless crisis response system determines need and vulnerability through housing assessments that pair people with the services that they most qualify for. So an effective homeless crisis response system is required to have specific key elements that you'll be seeing in the data from each, and you'll be seeing data from each of these key elements here tonight. So here's another way to look at the continuum of services in Clark County, because while my previous slide showed the continuum using a straight line, nothing moves in a straight line when it comes to working with people in crisis. So first, you'll see each key element here is importantly centered around data and planning. And the key elements of any homeless crisis response system are coordinated entry, which is the single point of entry for people experiencing homelessness to access services. And here in Clark County, that's the Council for the Homeless Housing Hotline. Then you have targeted prevention, which most recently has been the COVID-19 rental assistance. Then we have diversion, which is a one-time financial assistance and coaching technique for people who are homeless but just need a relatively small amount of help with move-in costs. Then we have emergency shelter, which consists of year-round shelters for individuals and families, temporary added shelter beds during the colder winter months at local churches, and even places like the new pallet shelters at the various safe stay communities around town. You also have rapid rehousing, which is housing plus supports for up to 2 years until someone can fully cover their rent themselves. And then lastly, you have permanent supportive housing, which is housing plus supports for people who are exiting chronic homelessness and who need supports and housing permanently due to physical health, behavioral health, and lack of ability to bring in income enough to meet their housing needs. And right now in Clark County, we have many hundreds of people who qualify for permanent supportive housing, and we don't have the physical units to place these people into. And this is why homelessness is so increasingly visible. And I also want to just focus again tonight, take some time to focus on the fact that this is our annual system numbers data, which is a full year of data. The annual system level data drives the goals and outcomes in the Clark County Homeless Action Plan. And oftentimes people get confused about the point in time count and the annual system numbers. So the point in time count is exactly what it says, data from a specific day, a specific point in time, if you will, that is done each year and is required by HUD and the Department of Commerce in Washington. It's a way to get a finger on the pulse of the community on a certain day with the best available data in that moment. And because it's done around the same time each year in the same conditions, well, pre-pandemic anyways, it's good for determining trends and capturing data and helping to identify people and bring them into the system. However, I do just want to be very clear that tonight what we were talking about is the entire calendar year of 2022, and it encompasses every household who contacted the housing hotline, which, as mentioned earlier, is the coordinated entry point into the homeless crisis response system. And I also just want to say something about that. The numbers tonight are the households who called the housing hotline. It's likely that some households experienced homelessness and did not call the housing hotline for assistance. So there are a certain amount of people in our community who did not touch the system at all, even though they experienced homelessness. So if you're curious about the point in time count, you can view the data from this past January. It took place on January 26, 2023, and that's on our website, and hopefully Dale can post that link in the chat. It's also on this slide, so please feel free to check it out on our website. You can go to our website, councilforthehomeless.org, and you can go to the About Homelessness tab. All right, so now with all of that groundwork set, let's start with an overview for 2022. Dale is posting a link, hopefully, to our annual system numbers in the chat for your reference as well. So In 2022, homelessness continues to climb among residents of Clark County despite important local improvements in service delivery to people experiencing and at risk of homelessness. The number of unhoused individuals increased by 44% in 2022. The number of newly homeless grew as well. And despite the collaborative efforts of numerous Clark County agencies designed to house people, more fall into homelessness each year and fewer exit it. Finding a permanent home in Clark County has become less affordable and less attainable, and a safe, secure home is now out of reach for much of our population. We have a housing shortfall of about 103,000 units in Clark County. So in other words, we have too few units overall and not enough vacancies among existing rental units. And this shortfall exists throughout the spectrum of housing. So we don't have enough low-income units to allow those living on the streets to secure a permanent home. There are not enough middle-income units to allow those living in low-income housing to move up into the next level, and so on. And people are becoming homeless faster than we can serve them. And the bad news is that the number of people who are able to self-resolve their homelessness without the assistance of a homeless crisis response system program is decreasing, resulting in the number of people experiencing homelessness at any given time to rise. In 2022, 3,800 households were assessed for housing program assistance and 699 households were housed through diversion or a program. And about 2,400 households asked for emergency shelter and only about 1,800 households received it. And I just highlight this because please keep this data in mind when people around you start asking if people choose to be homeless. The fact is that people experiencing homelessness have very likely asked for help and just haven't received it. So now I'd like to introduce you again to Dale Whitley to talk about some of the system data. Again, Dale's the HMIS administrator for Council for the Homeless, and so he's going to just start us off by looking at some of the infographics with the 2022 data. So Dale, I will turn it over to you.
Hi, everyone. So this is the first of 4 slides that we're going to look at. These are all taken from our annual system number report. So we're going to kind of briefly go over these, but you'll have that opportunity to review the report more in depth. If you go to our website, you can find it and look over these numbers. So one thing I wanted to call out is that these are households. So 2022 equals 5,352 households. And then to the right of that, you can see the number of households from the previous year. And in 2022, for the number who called the housing hotline for assistance, you can see that it was 6,492. And then the number for 2021 is to the right of that. So same with these bar graphs. On the top in bold, we have the percentages for the most recent year. And then down below in kind of a lighter font, we have the percentages from the previous year. So you can see the comparison from 2022 to 2021. So each of these colored bars represent a different demographic group. So in the far right, you can see that key up in the corner, and this is going to be the same for the next 4 slides. The light purple is families, dark purple is seniors, and the orange is BIPOC, Black, Indigenous, and people of color. The green is youth, and the yellow veterans. And another thing that I want to call out that some people don't get when they first see this is that these numbers should not total to 100% because a household can be, the head of household could be in several groups here. You could be both BIPOC and a veteran, for instance. So sometimes people try to add those up, and that's just not what can be done. So an important thing to note in 2022 was that in these calls where you can see that our call number was down from the previous year by about 300 people. We also had an online portal for people that were seeking prevention rental assistance. And so it's very possible that this is an undercount as many people applied through that online portal and didn't necessarily have to call the hotline. Another a little number that isn't represented here is that 68% of the households who experienced homeless in 2022 were experiencing it for the first time. So that was 68%. We go to the next slide. Thank you. Oh. Thank you. So in this slide, we're looking at the households who asked for shelter and the households who accessed the shelter. And you can see the percentages changes from the previous year. And we can see up above the number of households that asked for shelter had increased in 2022 by about 1,000 households from the previous year. And the number who accessed it increased by about 679. So you can see that gap that there's still more people asking for shelter than we're able to access it. There's, so we know there's a lack of resources to move people out of shelter. This was one of the things. You have to have movement. You have to have places to move people to, and so that's one reality of our situation here. Next slide.
Dale, I think I skipped this one. So did you do this one or?
No, I think that was the first one.
Oh, okay. Yep. Sorry, my bad. Okay, here we go.
Okay. So these charts here, we're looking at the number who were assessed for housing programs and the number who entered one of our 39 housing programs that we can place people into for those people who qualify. And so we can see that there is a big gap between the number of who are assessed and the number who are able to be placed into a program. We actually did place more people, 60 more households in 2022 from 2021. But that doesn't cover that big increase that we saw from 2021 to 2022 of those who were assessed. Now there has been an expansion of efforts to assess people. One thing that we've had in Clark County that we benefited from this past year was an expansion of our outreach teams. We have coordinated outreach teams who are trained as assessors to actually go out and count people living in the streets or outside. So we both expanded the number of teams and the number of staff in those teams. So that could explain why we have so much more assessments going on in 2022. So only 15% of households who were assessed for a housing program were actually able to enter a housing program. So the need is enormous. The programs, we have to have funding to have programs. And even if programs are funded, we have to have affordable housing units to move people into. Next slide. So this first graph on the left is looking at the households who received rental assistance to prevent homelessness. And you can see that number of households in 2022 was 5,218. So a large number of households who received rental assistance. And, up from the previous year of 4,785. And then on the right are housed through coaching and one-time financial support. And we actually had a small decrease in 2022 from 2021 in the number who were able to receive what we call diversion. So some of these programs are specific to BIPOC families, such as our FACE program. And that could explain why you see such a 67% of the households served through diversion were BIPOC. And next slide.
All right, thank you so much, Dale. Yeah, I appreciate you just taking us through those infographics. And again, those are on our website, and I did fix the chat. So if you don't mind reposting those links that only went to us, that would
I
be
will do
great.
that.
Thank you. Thanks everyone for your patience with that. Um, it's hard to do Zoom when you're also presenting. So thanks to Gary also for letting us know we had an issue. All right, so now I'd like to introduce you to Sunny Wonder. Sunny is the Deputy Director for Council for the Homeless, and so she is going to put some of that data that we just saw into context, and also talk about key takeaways by each service type, which were those key elements that I reviewed earlier tonight. So Sunny, I will turn it over to you.
Hello, everyone. Thank you, Laura. So the first area that I'm going to talk about tonight is about coordinated outreach. Dale mentioned an expansion of our coordinated outreach teams. That expansion, the real work began in late 2021 to expand our coordinated outreach teams. The goal of coordinated outreach, we've recognized that, there was a question about the housing hotline and, just thinking about accessibility to our system. The reality is that many folks that are experiencing homelessness might be navigating through phones that they're not able to charge their phones, so they're not able to call our housing hotline, or they're out further and aren't able to take a bus line to get into our office. So our coordinated outreach team is really focused and prioritized on the most vulnerable in our community who are unable to come to us. We want to make sure that we're going out to them. So that's really the goal. And you can see that we've seen some real successes. Most definitely over 2022, we saw an outreach workers increased to 30 people and across 7 different agencies, which is really amazing. And just for context, prior to 2021, we had a much smaller team, like thinking just a handful of folks that were going out and doing that same work. So just a huge expansion in the number of the folks that we're working with. Over 263 individuals were housed through coordinated outreach in 2022. So just some really significant successes that we've seen with this group, with this coordinated outreach team. And you can go to the next slide, please. Thank you. So with rental assistance has been, the federal rental assistance has been a lot of what our community has been talking about, a huge influx of federal dollars right at the beginning of the pandemic, and 2022 was no different. We saw most definitely continue to see a pretty significant amount of dollars in the community. So doing big rental assistance openings, Dale mentioned folks calling through the hotline, but seeing that decrease and knowing that we also had a portal in an effort to make the process a bit more accessible for folks who weren't able to call, and knowing that those hold times when potentially thousands of folks are calling in. So that portal was a big piece of it as well. With these dollars, the focus is, of course, to quickly kind of emergency assistance. So typically it's provided, most definitely with the federal rental assistance dollars, it's typically one-time assistance, and it's not on an ongoing basis, but one-time assistance, and it depends on the funding type. But for what the assistance is being provided, but that is going to be one-time assistance, and then hopefully the household is stabilized. And with that, we saw 5,218 households receive assistance in 2022, which is up from 4,785 in 2021. So we did see an increase. The amount of funding that went out the door was more than $26 million. And just as a reminder, the federal funding is going to be ending in 2023. But as we have mentioned, and definitely is not a new topic, folks are aware that rental costs have continued to skyrocket. And that is just an ongoing challenge that we're continuing to see a need for rental assistance in our community. And next slide. Okay, moving on to diversion. Diversion, the idea of diversion is really for diverting from this larger homeless response system. We often have folks that are just needing a little bit of assistance. They might need assistance in identifying a place that is a bit more flexible. Perhaps they have a recent eviction and they're getting turned down by a lot of properties. So might need just a very small amount of assistance on where to go and how to get approved for a place. Other things, considerations, most definitely financial assistance, as we've seen move-in costs increase, folks needing just some assistance in getting into a place, and then the assistance that is just that one-time assistance. With this, what we saw over 2022, we've continued to see a decrease in households that are accessing this resource. In 2020, we saw 171 households, 143 in 2021, and then 134 in 2022. So one of the pieces there that, without knowing fully and talking to each individual person, but one of the trends is keeping in mind the eviction moratorium, as well as increasing costs that a lot of folks that we talk to, a lot of what we've seen is that folks are either choosing to stay where they're at because it feels like the most stable option for them as we've navigated through the pandemic. We are most definitely seeing an increase in requests now, so we are anticipating that will start to increase when we are sharing the 2023 numbers. Of the 134 households, it did continue to remain true that a significant number of households identify as BIPOC, and that most definitely was true in 2022 with 67% of households identifying as BIPOC. Next slide. Okay, with emergency shelter, we had more folks than ever seeking out emergency shelter, as well as receiving emergency shelter. One element of consideration, we know that during the pandemic, the number of beds available was decreased to accommodate and provide spacing for folks as much as possible, even in congregate shelter, while it can be very difficult. So that was one factor. So just thinking about the increased beds that we saw in 2022 from previous years, the COVID most definitely impacted the number of beds. We did see a significant increase, and we did actually add shelter beds in 2022 as well. So in December 2021, we had 120 beds that were added. And then an additional 72 beds were added in 2022, which brings us to a total year-round shelter of 393 beds. One of the really big pieces when we think of the number of folks that are seeking out, that are seeking shelter and knowing that we have 393 beds, one of the really big factors that we're looking at is how increasing housing costs are preventing folks from moving successfully from shelter space into housing. So that is most definitely, with a lot of this, just the resources needed and the ability to pay for rent in our community continues to increase. So that has most definitely been a big challenge and something that we see show up when we look at these shelter numbers. Next slide. Thank you. And moving on to housing programs. In 2022, as was mentioned, Dale mentioned just that we have been completing more assessments. Most definitely in 2022, that has been a huge focus with 30 coordinated outreach workers that are trained to do assessments. We definitely have increased our capacity to do assessments in the community, and that most definitely has been a priority. The number of folks, we did also see the number of folks who are placed into a housing program did also increase from 515 placements in 2021 to 565. As a percentage, the number of assessed households who entered one of the 39 programs did fall from 17% in 2021 to less than 15% last year. So just again, keeping in mind the number of folks that are seeking assistance most definitely continues to increase. Oops. There we go. Sorry about that. Lost my place. So with 765 more households assessed, up 25%, 565 households placed into program. Just looking at the actual exits from these different program types, 47% of households served through rapid rehousing exited to permanent housing. And when we're looking at transitional housing, so transitional housing is 47% served through transitional housing, exited to permanent housing. And then 93% of households served through permanent supportive housing exited into permanent housing. And here we go. And if you could go to the next slide, Laura. Okay, so moving on to trends with youth and families. So youth and young adults ages 12 to 24, just some context on that. So youth and young adults, we're going to look at the number of youth that are, we don't necessarily have pulled out on unaccompanied youth that are under the age of 18, but youth that are either unaccompanied, so without a family member, or another adult that is in their household with them, as well as youth that are a part of other families. And then young adults are typically going to be ages 18 to 24. So with that, we saw pretty similar numbers from 2021 to 2022 of our system saw 9,032 people experiencing homelessness. 788 of those were between the ages of 12 to 17, and another 788 were between the ages 18 to 24. Youth that were 12 to 17 were most often would have a parent or guardian when they're experiencing homelessness together. And then, of course, youth ages 18 to 24 would typically be folks that are experiencing homelessness on their own. Youth often face unique and broad barriers to resolving their homelessness. They're often struggling to identify, not necessarily knowing the system and how to identify services. That most definitely is a really big factor of not knowing where they can go to seek services. And really are focused on daily survival. So they might often, their homelessness might look a little bit different. They might be staying here, staying there, able to couch from time to time. So that is also a big factor, that often moving around to different locations. Another really big factor is that our system is often not designed to help people under the age of 18. So if you're under the age of 18, typically you're not going to be able to sign a rental agreement, for example. So that most definitely is a pretty big factor. Having more limited income, most definitely during COVID, with impacts to employment. Often young folks were impacted very, very early and very quickly, more likely to be laid off, more likely to lose their jobs, was something that we saw a lot of. In response to the challenges that we've seen, Clark County did apply for and receive the Anchor Community Initiative grant. With this grant, this is focused on ending and preventing youth homelessness, and it's really about developing collaborations with providers, both providers that are providing youth specific services, as well as providers that maybe aren't specifically serving youth, but they have youth that are accessing services, and also working with partners outside of our homeless response system to ensure that we're being collaborative and really wrapping around youth. And it is really designed to be led by youth as well. So we have created a youth advisory board, as well as some groups that are specifically focused on getting together and having conversations, as well as identifying resources, applying for funding to really centralize the work and ensure that we're working towards getting as many resources in place as possible for youth to be able to quickly access services they need. And then moving on to families, as with many populations in 2022, rates of homelessness among families continue to increase, increasing their need for assistance. One example of this, the housing families that called the housing hotline and sought emergency shelter increased in 2022. However, the percent of people that access shelter and housing programs, as well as those who entered into diversion, fell. The lack of affordable housing in our community means it is often taking longer for families in shelter to move out into permanent housing, which is decreasing shelter space designed for families. One partnership that we're continuing to be very excited and proud of is our Homeless Student Stability Program. Council for the Homeless partners and collaborates with our family community resource centers located in Vancouver and Evergreen school districts. We really focus on quickly identifying families that are needing support, so who either meet the McKinney-Vento definition of homelessness, so they might be staying with friends or family on a temporary basis or literally homeless, to quickly get them connected to our coordinated entry system. With this model, we are using diversion, so quick divert from the system, providing coaching and financial assistance. And with that, we can also ensure that households aren't having to do additional work, but quickly bringing the services to them. And if that service isn't going to work for them, that we're able to go through the assessment process and get them connected to other resources. Next slide. Okay, so focusing on veterans. With coordinated efforts to house veterans increased in 2021, there was little change in veteran-focused data in 2022. In 2021, Clark County implemented the tools and best practices of Community Solutions Built for Zero initiative. With this initiative, veterans are a focus population, and this effort is led by Council for the Homeless, but we work with a lot of different partners across multiple agencies and systems. With this information, we're analyzing real-time data and collaborate on solutions for each veteran on a by name list. These tools help service providers more effectively and efficiently serve veterans experiencing homelessness. In addition to the Built for Zero initiative, we also are working to strengthen partnerships with veteran service providers. We found new ways to connect veterans experiencing homelessness to Veterans Affairs and to civil programs and support. In many communities, veterans and civilian programming operates in silos. In our community, we saw an increase in integration of program delivery and coordination of services. This is a significant point of progress and most definitely something that we are proud of in increasing the collaboration and reducing siloing. Moving over to seniors, with seniors, we saw numbers remain steady from 2021 to 2022 for the senior population as well. With seniors most definitely facing particularly unique circumstances to end their homelessness. Of the 9,032 people who were experiencing homelessness during 2022, 1,038 were seniors ages 55 to 69. And 143 were age 70, over 70 and over. One of the biggest barriers for this population, as you can imagine, is that seniors are often on fixed incomes and they're not able to, of course, very limited ability to go and get a job to increase their income, which has most definitely made our ever increasing costs in Clark County a huge challenge and barrier for our seniors that are experiencing housing instability, as well as seniors that have slipped into homelessness. Just for context, a monthly Social Security insurance payment in the state of Washington averages $952 a month. So paying 30% of this income in rent, a senior can afford $286 in monthly rent, which the fair market rent for a studio apartment in Clark County today is $1,500 a month. In 2022, service data for seniors remained largely unchanged from 2021, but the trends for seniors from 2019 forward show an increased focus on their stability. Housing programs engagement increased from 18% in 2019 up to 19% in 2020, and 25% in 2021, and 24% in 2022. We did see an increase in seniors requesting and accessing shelter where they were more connected to additional services. Next slide. Back to you, Laura.
All right. Thank you so much, Sunny. I appreciate that context. All right. So now I would like to introduce you to Shavana McEwen, Council for the Homeless's Equity and Advocacy Director. Shavana is here to talk about why racial equity needs to be at the center of the homeless crisis response system, because members of the Black, Indigenous, and people of color community in Clark County are most impacted by homelessness. You might think back to those bar graphs earlier and how every line in every one of them was the tallest one was the orange line that represented our BIPOC community. There are many systems that impact who experiences homelessness and how complicated their situations become. So I'm going to turn it over to Shavana now to talk about some of the 2022 system data that highlights the successes and opportunities to improve outcomes for Clark County's BIPOC community. Shavana?
Thanks, Laura. And I also, just before I get started, I do want to say thanks to folks who are throwing their questions up into the chat. You're firing them away a mile a minute, and it's hard to get to all of them. I believe our contact information for everybody on this webinar tonight, all the panelists, our contact information is on the website. And so please feel free to reach out to any of us with further questions if we're not able to get to your questions tonight. Again, they're great questions. This is specifically about the homeless systems numbers report. And so, but we're always, we talk homelessness all day long. We're always happy to talk with folks. So please connect with us. I'm not going to do a lot of history tonight because we covered the history pretty extensively in some other webinars. And I think folks have heard a lot about the history of why we need to try and center race in our equity work. But I do want to say that, we are doing a good job of, as Council for the Homeless, trying to continue to disaggregate our data. Equity, we center our work in race equity, but equity is not restricted to only thinking about how we're serving Black, Brown, Indigenous, or other people of color. Equity work is also talking about how are we making the hotline more accessible to folks who maybe aren't able to call in on the phone, folks who are deaf or hard of hearing. How are we trying to make our forms accessible to folks who have different languages other than English as their primary reading language? And it encompasses a host of other categories as well. However, again, tonight we are going to focus our conversation on race equity in particular. A big reason why we do that is because of the history. Another reason why we do that has to do with numbers, and the simple fact that in Clark County as a whole, people of color, whether they're a makeup of Black, Indigenous, Asian, Latina folks, make up less than 20% of our population of our county, but are more than 40% of folks experiencing homelessness in the county. And so we need to take a look at what is going on with folks of color. Why is housing so inaccessible for folks? And if we're able to do that, then we believe that we'll be able to make housing more accessible for other folks as well. So Laura, I know that this, as I mentioned, this is a webinar about the homeless crisis response system, but as you alluded to earlier, The system does not exist in a silo. And when we talk about racial equity, it's not adequate to only talk about people who are currently experiencing homelessness. The next couple slides, I'm going to talk a little bit about people who likely represent this increase in homelessness. Folks who are experiencing housing instability and who fell into homelessness, not because of laziness or the color of their skin or by any fault of their own, but because the systems at play and the solutions that were presented have not been built for the needs and success of people of color. Next slide, please. So if you look at this map, which was created using census data, along with other census data, you can clearly see a visualization of the fact that housing stability is getting harder and harder for our neighbors of color to maintain. Between 2010 and 2020, the population of people of color in Clark County grew by 76%, from 78,000 to more than 137,000. There are middle schools and many elementary and preschools across both Evergreen and VPS where the student body is comprised of minority majority, meaning that students of color make up the majority of the student body. Knowing that the demographics in our community are rapidly changing, we need to see policy changes that are accounting for the fact that housing doesn't look the same for all people, and solutions to housing instability aren't necessarily the same for people of color as they are for white folks. Next slide, please. I want to talk for just a moment about the cost, about being cost burdened. Actually, if you could go back to that last slide, Laura, sorry. So you can definitely see on this slide that there are specific communities in Clark County that are historically have a higher rate of people of color. Those incidentally also are the communities, the census tracts that have higher rates of poverty and have higher rates of homelessness. So there is correlation between rates of poverty, between rates of poverty and rates of homelessness. And we know statistically that people of color in Clark County typically have higher rates of poverty than white people. So if you could go back to the next slide, Laura. I do want to talk for a moment about being cost burdened. U.S. Housing and Urban Development defines cost burdened as having to pay more than 1/3 of a household's gross income on housing. As Laura mentioned earlier, I believe Laura mentioned earlier, the average market rate for a 1-bedroom rental in the city of Vancouver is over $1,400, meaning that an individual would need to gross nearly $51,000 a year to afford a 1-bedroom unit. For a person working minimum wage in Clark County, he or she would need to work roughly 73 hours per week to afford that unit. In 2022, in the city of Vancouver, where more than 40% of the county's rental units are located, over half, 51% of households are cost burdened, and the overwhelming majority of those homes make less than $50,000 a year. We also know, as we've talked about the rising rates of rent, the US GAO analysts found that a $100 increase in median rent led to a 9% increase in homelessness across the community. So for every $100 rent increase in median rent, another 9% rate increase in homelessness occurs across the community. As you can see in this graph, people of color typically have a lower median household income than white folks do. Next slide, please. Additionally, we can't talk about solutions to homelessness without talking about solutions to poverty. People need stable housing to end their poverty, and ending poverty is often needed to maintain stable housing. Increasing the child tax credit, a guaranteed basic income, increasing minimum wage to a livable wage, decreasing the cost of childcare, and the Supplemental Nutrition Assistance Program, also known as SNAP, are all examples of policies and programs that have been shown to decrease poverty levels and increase housing stability. Sometimes we think of these policies as being radically progressive, but in reality, they're programs that have been proven across the country and even across the globe as programs that lift people out of poverty and keep them in their homes. We talk a lot about what's happening in the system, but again, in order to think about what's happening before somebody gets to the system, we need to think holistically about how we can support people in lifting them out of poverty as a way to help them maintain their housing. People of color in Clark County are significantly more likely to experience poverty and homelessness. The numbers on the lines indicate the greater vulnerability. So your likelihood of experiencing poverty is directly, again, correlated with your likelihood of experiencing homelessness. I also want to make a point to say that these are, I'm pointing out poverty rates as being more prevalent in communities of color, not because there's anything wrong with people of color, but because there are more systemic barriers that exist to creating generational wealth, to creating individual wealth for people of color than exist for white people. Again, not to say that there aren't also low-income white people, but to say that the systemic barriers are more present for people of color than for white folks. Can you go to the next slide, please, Laura? So key takeaways about equity from our systems numbers report. Again, probably the biggest takeaway is that we're realizing that Clark County's Black, Indigenous, and other people of color experience homelessness at a higher rate than any other demographic group. While they also requested and accessed more services, such as calling the hotline more and being able to be placed in services more than they had been the year before, the needs for these communities must continue to have a high priority. Given, again, that the BIPOC population comprises about 15 to 20% of Clark County residents, the fact that 44% of those who are homeless in 2022 underscores the need to prioritize BIPOC individuals and families as we strive to eliminate homelessness. BIPOC individuals represent BIPOC individuals are present in 54% of the families we served in 2022, or at least one family member identified as being a person of color. So I do think that that is a significant takeaway that I would like to uplift, that we are, that the representation is that we are serving more people of color in families than are overall represented in the community. This indicates that Clark County, sorry, it's really hard to look at the screen and read my notes at the same time. Thanks for your patience. This indicates that as Clark County continues to emerge from the pandemic, the systemic and social barriers that people of color face continue to present challenges for them that white people and families do not face. By any measure, the burden of homelessness fell particularly hard on our Black, Indigenous, and other communities of color. As we know, COVID also had a disproportionate impact on those neighbors, and the recovery is also disproportionately leaving them behind. However, it's also important to note, again, that programs such as diversion have been successfully provided to individuals and families of color. It's also important to note that we're continuing to see a decrease in the disparities between the rates of people calling and asking for help, and then also being connected with support. This was the statistic last year that stood out the most to me, was that we were drastically underserving people of color who were calling and asking for services, and we've seen a significant increase in that statistic this year in terms of better being able to serve and assist people calling. These statistics point to the continued importance and success of racial equity trainings across the continuum of care, and a continued emphasis on dismantling systemic barriers that exist for our neighbors of color. We're also still seeing a positive impact on the tool that we use to assess families, and continuing decreased disparities between the vulnerability rates that white individuals and families serve compared to Black individuals and families. Next slide, please, Laura. Lastly, I want to go ahead and lift up that Council for the Homeless loves to say that the solutions to homelessness are a community, are found in community, and we have incredible community partners who are doing incredible work trying to both assess the need for folks of color in our community, as well as provide services to those communities. One group that's not on here is Clark County Public Health in their community needs assessment, and want to uplift them as well as the other groups who are on this page, and just say a big thank you to all of those groups for the work that they're doing. I think I went over my time, Laura, so I'm going to go ahead and wrap it up and pass it back to you.
Thank you so much, Shavana, and thank you to everybody tonight again for the conversation and information being shared. It is my pleasure to introduce you to Cecily Fenney-Jones, the Council for the Homeless Executive Director. She's going to talk to us tonight about our reasons for hope going forward. So I'll turn it over to you, Cecily.
Thanks, Laura. Good evening, everybody. I just want to share with you that about a year ago, I made the decision to join Council for the Homeless by moving from the Midwest to the Pacific Northwest. What brought me to Council for the Homeless is the fact that the mission is to prevent and end homelessness. We understand that homelessness is complicated, but it's solvable. I hope that you remember that as you have conversations tonight with your friends and family about this webinar, that you remember that it's complicated and solvable. I also hope that you remember that we house about 700 households per year. It's easy to focus on the visible homelessness and houselessness in the community, but we are doing really, really great work. We just need to do more with more resources. I want you also to remember that 15% of people who requested housing services received it, only 15%. That means 85% of people who wanted housing or needed housing services did not receive the help that they were requesting. I want you to also understand that living on the street is traumatic for people. They experience high amounts of trauma. And when the community partners go to them to help them to get off the street, we are required to show them compassion and meet them where they're at. That is a process of rapport that takes some time. So solving homelessness and getting people off the street takes a period of time. Again, we need more resources. Clark County is doing great work. These agencies are amazing. What I am really happy about being a part of this community is that there are so many people, providers, agencies, advocates that are working so hard to get people off the street, to figure out what do we need to do? How can we solve this? Do we need to get together and talk about this? How do we get things to a place where if people are getting to a place where they are homeless, that is for very short periods of time, that visual of the faucet is running quite slowly and it's going right down the drain. I hope you remember that this is something that we need to do as a community. Like Shavana said, this is not going to be just solved by one person. It's going to take everyone's actions and advocacy to get to a place where we can end and prevent homelessness. Back to you, Laura.
Thank you so much, Cecily. All right, here we go. Thank you, everyone, for being here tonight with us. I'm just going to end our evening together by again thanking our incredible panel of speakers. And as we wrap up our time together, people often ask us, why is homelessness only increasing in our community despite the efforts that you've heard about tonight? And that might even be what motivated you to attend this webinar. And a review of our data gathered throughout 2022 paints a picture of a system that has significantly expanded services and made improvements to how people are supported, and has also found success in getting people housed and supported in stability so that they don't return to homelessness, and yet is still unable to meet the demand for services that are caused by a historically sharp rise of newly homeless households in our community. And remember, 68% of people in 2022, 68% of households were newly homeless who contacted the housing hotline and the crisis response system. So here's where we invite you to take action after learning this data and the real people that it represents. Advocate for coordination across services and systems, because that's how we bring the most resources to bear to end homelessness on an individual and community level. As mentioned earlier, in 2022, 6 additional agencies began entering their homeless services data into HMIS, bringing that total to 39 agencies. You can also help advocate for better public policy and funding for housing and homelessness services by signing up to be a housing advocate. Dale's going to post that link in the chat for everybody. And hopefully you've seen tonight just how interconnected it all is. You know, what Shavana talked about with our racial equity data and, you know, the partnerships that, you know, we are, engage in out there, and the coordination of, you know, outreach and entry into the system. It takes all of that working together. So if you're, we invite you all who care about homelessness into this community. If you're a community group or a member of a faith community, we want to help. We want to bring you in and help you engage in solutions to homelessness. Just let us know. We would love to come in and talk with your groups and brainstorm ideas. You can donate supplies and money to the organizations that are working to help people resolve their homelessness. If you take a look at our system numbers report, and this all is on our website, I saw a lot of things in the chat tonight, questions, sorry, my Zoom background, but it's on there. But there is a list of agencies that you can support by donating money or supplies to. It really is a good way to leverage your dollars and help make them go farther. And then educate, let people know what you've learned tonight. You can share data, dispel myths, reduce the stigmas of homelessness. This webinar will be recorded, like I mentioned, and we will send out the link to view it after. You can share that with friends or family, colleagues. And last but not least, as we always end our webinars, be kind to the people that you see on the streets. They're often just treated either as if they're invisible and don't exist, or with fear or anger, and it takes a toll on a person. So please be kind as you encounter folks out there. And then there's an event coming up this fall. It's called Gathering for Change, Solving Homelessness Together. It's Council for the Homeless. It's taking place either virtually or in person at Kiggins Theater on October 19th. And we are going to welcome a nationally recognized leader in ending homelessness, Mark Eichenbaum from the city of Houston, Texas. He will be the keynote speaker, and he's going to share the steps that the city of Houston took through the Way Home effort to find permanent supportive housing for 25,000 people over the course of 11 years. To learn more about Mark and to register for this event, you can also visit our website, and I think Dale's going to drop that link into the chat as well for everybody. So again, please check out our website. You can download this report that we have pulled numbers from tonight to share with you all. You can look over it more closely. There'll probably be some answers to some of the questions that came up as well. And just want to thank everybody for attending tonight, and we will see you next time. So hope you all have a wonderful evening. Thank you so much.